5R strategy for quitting tobacco. We will go ahead with this strategy only when we get to know that the 5A strategy is not working. That is the ask, advise, assess, assist, arrange. If these 5 strategies are not working, we will go ahead with 5R strategy. So what is a 5R? So first is relevance. First R is relevance, then the second R is the risks, and third R is the rewards, fourth R is the roadblock, and fifth R is repeat. So moving on to the first R, that is relevance. So when you are going to give counseling for the patient, you should give counseling in such a way that the counseling is relevant to his situation, or it is relevant to his scenario. For instance, if you are giving a counseling for a person, a man who is above 50s or something, you should tell him the risk of him getting a cancer, oral cancer or any other cancer, and there is a chance of for him to die at an early stage. So he is reducing his actual lifespan, and this is the risk involved. And if you are going to give counseling for a female patient who has a smoking habit, probably you can tell about the aging, which the premature aging which might develop due to the prolonged use of tobacco, and reduction or complete quitting of this habit will have some improvement in the appearance, aesthetics, and in the it will at least not increase this aging process. Okay, so these are the relevance which are likewise we can give relevance for each and every group of patients. So next we'll move on to the risk. Second R is the risk. Risk is nothing but if you keep continuing this habit, like you risk yourself, you risk your family members, and you risk the health of the people surrounding you. So those are the risks involved, and the risk being the developing oral cancer and reduced quality of life and premature death, aging, and the risk of reduced fertility in males and females. So there are many risks involved in smoking. So next, moving on to the third R is the rewards. So if the patient is quitting this habit, what are the rewards which are involved in it? So if you can explain the patient, like you can give a rough calculation to the patient, how many cigarettes you need to ask the patient how many cigarettes you smoke in a day. Say the patient gives you a rough number of I smoke about 10 cigarettes per day. Nowadays the cigarette cost on an average of around 17 or 18 rupees or something like that. So you can multiply it by 10. So 17 into 10 is 170 rupees for one day. So this is the cost involved for one day of smoking. So into 10 into 1 week and into 365 days, and that will significantly have a huge sum. Okay, that will sometimes even if you have if you can get the track record of his previous smoking expense, you will be surprised, like it will be coming around to 20,000, 25,000, 50,000 or something like that also. So you can tell him the amount of money he get to save for not continuing this deleterious habit. So you can portray that as a reward. And the reward of increased energy level, that is also there. So next is the roadblocks. Roadblocks to smoking is that, so whenever the patient, even he tries to quit smoking, there is physical roadblock, there is a psychological roadblock. So the patient won't be confident. I have been dependent on this habit for these many years. Will I be able to sustain this non-smoking lifestyle? So all those roadblocks they'll have to identify. Even if the patient has an intention to quitting, certain environment will trigger their instinct to take a cigarette and puff. For instance, the patient used to smoke in a tea shop or something. Whenever he sees a tea shop, that will send a trigger message to light up a cigarette. Or if the patient has been having the habit of smoking cigarette as early as half an hour within he is waking up, so that is also a habit. So a habit which has been formed for so many years, it is quite difficult to break in one particular day. So we need to identify what are the roadblocks. So when the patient is having temptation to smoke in spite of his or her intention to quit smoking. So these are the roadblocks. And coming to the fifth are repetition. So you are following all this method on the, like any attempt, there will be, of course there will be failure in quitting smoking also. You need to retrain the patient and reinstill the patient that this can happen for anybody, and there can be multiple failure quit attempts, and they can achieve success even after multiple failure attempts, and not to get dejected in the first go or second attempt or something. Keep repeating this attempt to quit tobacco and encourage the patient and give support for the patient. Ultimately he will be able to achieve with his willpower and your counseling and supportive environment.
Now we are going to see about the benefits of quit smoking. We have already described the negative consequences of smoking, but do you know how many benefits you can gain from quitting? You might be surprised. First and foremost, the decision to quit smoking can truly be a life-saving one. Just as continue to smoke set you up to experience life-threatening health problems, quitting can reverse the process, making you healthier today and more likely to avoid serious health problems in the future. This section outlines some of the reasons that may help you to decide that the benefits of quitting are greater than the benefits of continuing to use tobacco. Actually, because many of the health risks associated with smoking can lead to death, the most important benefits of smoking cessation is the ability to choose life over death. Actually, it is estimated that the average male smoker loses about 13 years of life and average female smoker loses about 14 years of life. Also, because of the effect of quitting start on the very day you stop smoking, former smokers live longer than people who continue to smoke. Smoking cessation has immediate and long-term consequences for a smoker's health. Beneficial health changes that takes place after quitting the smoke. Within 20 minutes, your heart rate and blood pressure drops. Cigarette raises our blood pressure and increases our heart rate. Our heart rate will begin to drop to normal levels within 20 minutes of our last cigarette. And then coming to 8 to 12 hours after quitting, our blood carbon monoxide level drops. Actually, carbon monoxide is the same dangerous fume that comes from the exhaust smoking. It causes your heart rate to increase and causes a shortness of breath. Within 8 to 12 hours, the carbon monoxide levels in our blood drops and our blood oxygen increases. Actually, after 48 hours after quitting, your ability to smell and taste improves. The nerve endings damaged by smoking begin to regrow, improving our sense of smell and taste. And then 2 weeks to 3 months after quitting, our risk of heart attack drops. Improved circulation, lower blood pressure and heart rate, better oxygen level and lung function all reduce our risk of heart attack. 1 to 9 months after quitting, we will feel less shortness of breath and cough less. Coughing, shortness of breath and sinus congestion will decreases. Feel more energetic overall. And then coming to 1 year after quitting, our risk of heart disease will be cut in half. Smoking significantly increases our risk of heart diseases. Moving on to 5 years after quitting, our risk of stroke decreases depending on how much and how long you smoked and overall health. Our risk of stroke will be the same as someone who has never smoked within 5 to 15 years of quitting. 10 years of quitting, your risk of lung cancer drops to that of someone who's never smoked. Your risk of dying from lung cancer will be that of person who's never smoked. Our risk of developing other cancers decreases significantly. And moving on to the final 15 years after quitting, risk of heart disease is the same as someone who never smoked. After you quit, you will have a lower cholesterol, thinner blood, which reduces the risk of blood clots and lower blood pressure.